Hello again. This is Arabella Hayter, and you've reached our final module in this course, where we will focus on the WASH-FIT process at the national level, from initial implementation to national rollout. In this module, we will look at some of the things that happen beyond the facility, which are needed for WASH-FIT to succeed. We will take you through the full process from initial implementation to sustainability and scaling up. We'll also look at how to tailor WASH-FIT to specific national contexts and share some real-life examples. For WASH-FIT to have maximum impact, it's crucial that the tool is adapted to fit the specific national and local context and needs, and that it has sufficient political commitment and leadership. This should be reflected in policy frameworks, for example, national standards on wash and waste. Training and capacity building at national and local level, as well as sustainable financing and investment, are also essential. Regular supportive supervision and mentorship can maintain momentum, and by sharing WASH-FIT data from facilities to the national level, can help to improve resource allocation. Human resources, that is, sufficient skilled staff, and participation of the community are also key, as these help ensure that any improvements made are both effective and culturally appropriate. Together, these elements create a strong foundation for WASH-FIT. The importance of political commitment at both the national and local level cannot be overestimated. In Lao PDR, the advocacy of the Deputy Director of the Local Health Office led to increased funding, which was needed for the successful scale-up of WASH-FIT. Government leadership helps to integrate WASH-FIT into health systems, guidelines, and budgets. And leadership is needed for long-term success to help provide ongoing and regular financing, technical support, and mentorship. When government formally endorse WASH-FIT as the national tool, it mandates stakeholders to use a common approach to training, assessment, improvements, and data sharing. This will lead to a more efficient use of resources. Ongoing training and capacity building are a big part of WASH-FIT, beginning with sensitizing national officials and stakeholders who then adapt WASH-FIT to the local context. This crucial first step should ideally involve WHO and UNICEF country offices, alongside NGOs and other local implementing partners. The Ministry of Health, supported by these partners, and using the locally adapted version of the tool, will often run a training of trainers program to develop a cadre of instructors who will disseminate knowledge from the national to district and down to facility levels. Developing a cadre of trainers who cascade training is particularly helpful where facilities have high staff turnover and training needs are high. Regular refresher training for facility staff will likely be needed. You may wish to read the WASH-FIT training manual for more information. In Liberia, a national WASH and environmental health package was developed, which incorporated WASH-FIT. This was followed by training of trainers nationwide, who could then pass their knowledge to the district level. Progress on key WASH indicators was reported and analysed nationally, which provided a feedback loop for continuous improvement. Sustainable financing and investment are pivotal for the long-term success and continuity of WASH-FIT. This must be accompanied by long-term strategic financial planning. Sufficient funds will be needed to cover startup costs for launching WASH-FIT, including initial training and dissemination of tools, capital costs for significant infrastructure upgrades, and recurrent costs for daily WASH-FIT activities, for operation and maintenance, consumables, and supportive supervision. But where should the money come from? Well, capital costs often require multi-ministry collaboration and donor support. Recurrent costs are usually covered by facility discretionary budgets or allocations from the municipality, district, or national budget. In many countries where WASH-FIT is well established, supportive supervision has helped maintain progress. This involves providing technical support, troubleshooting any problems, and helping with course corrections, as well as promoting best practices. It can be carried out by district health authorities or integrated with broader national monitoring. In both Mali and Lao PDR, local health authorities are consulted during regular review meetings and provide troubleshooting help, and in some cases, additional funding. In Mali, community groups help review assessments and improvement plans and provide feedback on what the priorities for improvement are. Facilities should regularly share WASH Fit updates with the district health authority, ideally quarterly or biannually. This helps local government know where problems are greatest and prioritize resources. Using digital tools like Kobo Toolbox simplifies real-time data sharing. A version of the WASH Fit assessment tool for Kobo is available for you to use and adapt. This can really help you to streamline data entry, analysis, and sharing. Implementing partners have an obligation to share data with government to improve coordination and minimize duplication of effort. In the WHO Middle East region, an online portal on Microsoft Power BI is being used to optimize the reporting process, enhancing the tracking and management of WASH Fit across multiple countries and regions. We have already touched on the importance of leadership in creating a positive culture of change, particularly for hand hygiene and cleaning. Often, a single dedicated leader can stimulate widespread and positive change. Leadership from senior management ensures that problems identified are acted upon. It can also encourage more open dialogue, openness, and accountability. In Chad, facilities with committed and dedicated leaders showed notable progress in cleanliness, sanitation, and hand hygiene when compared to those without such leadership. This demonstrates that with committed leadership, significant improvements in healthcare quality and safety are achievable, even in very resource-poor settings. Active community participation and engagement is another important element of WASH Fit, as it helps to ensure that any improvements made reflect community needs and priorities. Including community representatives, local leaders, or influencers on the WASH Fit team can help demand better services and encourage community buy-in to the WASH Fit process. In Mali, where there is a long history of community engagement, the local community group agreed to provide additional funding to rehabilitate toilet blocks in a couple of facilities after a public hearing of WASH Fit results. Here are some takeaways from this module and a summary of the main enabling factors for WASH Fit. WASH Fit should be part of national health systems for maximum success. Political commitment and leadership is needed through policies, funding, strong leadership, and government adoption. Customization of WASH Fit to fit the national and local context should happen before starting. Remember, what works in one country or setting will not necessarily work elsewhere. Sufficient and sustainable financing should cover startup, capital, and recurrent costs. Supportive supervision through regular visits helps troubleshoot and facilitates learning. Real-time data sharing enhances decision-making, transparency, and collaboration. And facility-level leadership can make all the difference in achieving success. Finally, community participation encourages ownership, demand, and accelerates progress. Thank you for completing this module and the full course on WASH Fit. Please explore the reference section for links to all mentioned resources and visit our YouTube page for related videos and training materials. A step-by-step implementation guide, technical fact sheets, and paper, Excel, and online versions of the assessment tools and other support are available on the WASH Fit portal at www.washinhcf.org/WASH-Fit. Good luck in your work with WASH in healthcare facilities. And don't forget to complete the short quiz at the end of this module to receive your course certificate.